Hello. Hello. So let us begin with today's remedies for Nash Therapeutics study streak, and we have done almost 50 to 60 remedies or more than that. I've lost the count because we are doing almost 3 or 4 or 5 remedies at days, and today we'll pick up three important remedies. Number one is ferrum phos. Number two is Veratrum viridi, and number three is Veratrum album. This goes in sync with what Dr. Nash writes in his book, uh, Leaders in Homeopathic Therapeutics. So we will pick up some excerpts from the book and the experiences that he has shared and how he writes about those remedies and what is the importance. What are the key features that he tells us is important. So for ferrum phos, he has written only a page of the remedy, but the way he has written gives us some ideas about how important it is to think in the way Dr. Nash has thought. So let us see. The first line he mentions is that it is one of Dr. Schussler's tissue remedies and useful in inflammatory diseases. Now, when he goes to explain about ferrum phos, he knows that it is composed of two elements. So he starts thinking about ferrum phos as a remedy which has two components. One is the iron element and another is the phosphorus element. And then he tells us that the iron element has localized congestions and the phosphorus element will have affinity for the lungs, affinity for stomach, and thereby there also would be hemorrhage from the those organs or any other parts which would be bright blood. So this summarizes us about how a ferrum phos patient would appear or how it was proved or how we would see it in clinical practice. But he also tells us that ferrum phos is a remedy that would be suitable to pale and anemic subjects which have some complaints before the stages of exudation. So what is exudation? When the infection has spread or it has kind of started manifesting the symptoms which are beyond the control of the first stage of remedies, or it goes from the stage of inflammation to the stage of proliferation or infiltration in the surrounding tissues. So Dr. Nash had this very good idea about pathology, physiology, and the structure of the elements and the remedies, homeopathic remedies proved, and the poisonings. And that's why he could come up with some theories which were very primitive for his time. And that's why he has written in many of the books that this remedy needs proving. This, in fact, in today's three remedies, also for two remedies, he has written that this remedy needs proving. So you can imagine that when still the remedies needed provings or he didn't have sufficient data to present to the world, still he could come up with his cases and his books, which is very inspiring kind of. For ferrum phos, the last line he what Dr. Nash writes is that there are SAR eructations and there is this kind of a first stage of dysentery where ferrum phos would beautifully work, especially if there is blood in the discharges or there is night sweat which is accompanying. So this is how he wraps up the first remedy which we have picked up today. This is ferrum phos. Next, he goes on to tell us about Veratrum viridi. Now, this is a very nice remedy he shares where he tells about a tale of how it has been misused by many homeopaths of his time. Now we may have some clarity, but still I feel that this remedy is very less used as compared to what it should be used in our routine ways. So let us see what Dr. Nash writes about veratrum viridi. First or congestive stage of inflammatory disease, organs are under the control of pneumogastric nerve and the pharynx, esophagus, stomach, heart, whichever are innervated weighted by the tributaries of that nerve or that nerve per se, like stomach, are the seat of affections or the main source of affection for veratrum viridi. It was routinely prescribed for pneumonia in his time. But what happened to this remedy was that it was abused so many times that they had been giving it like a routine prescription. Every pneumonia case, they used to give veratrum viridi. Once it so happened that Dr. Nash gave this remedy to the patient and went out for a long visit somewhere. And he came the next day back and he found the patient dead. So that opened up a Pandora's box. And I think every homeopath should realize that he gets fixed in prejudices and how he can come out of these prejudices. So, what did he observe? He made 2 to 3 observations, which are very important. As a homeopath, if you want to upgrade your practice, you should also make these observations so that you know where you are getting prejudiced and what you are lacking in your practice. Number one prejudice was for veratrum viridi that it was used very indiscriminately, far more used, or rather, we can say it was abused. Second was there was a theory which was developed that it is a remedy used to control or depress the pulse. This was a very wrong concept which the homeopaths at that time or in his area had adopted. Third was that patients who had weak hearts were killed. So he found that all these three observations, two of them especially were negative, and the third one was that patients who had weak heart, those who were already in congestive cardiac failure, this is the term we have now, or those who had weak hearts, pulse was very weak, something like digitalis, and he goes on to compare digitalis also with veratrum viridi. Those were the remedies that they prescribed at that time, and they were used so badly that it led to death of many patients and to these observations from Dr. Nash. And that is why what Dr. Nash tells us that Gunsi tells us something about veratrum viridi and he contradicts those words. So in the all the remedies that we covered so far, 50, 60 remedies, we saw that Nash appreciates Grunsi's words, Herring's words, Ellen's Encyclopedia, Henneman Chronic Disease, etc., etc., all the texts. But right now, over here, he contradicts Dr. Gunsi's word and he tells us that this probably is a misnomer for this remedy, or maybe the homeopaths of that time have not understood. So he tells us that this remedy inflames the esophagus, stomach, congest the base of the brain, lungs, and the other action is not well known, so it needs more proving. And that's where he, just comes to a closure of this remedy, and he tells that severe cases of erysipelas were prescribed veratrum viridi by him, but they were accompanied by great delirium and characteristic tongue, which has a red streak in the center. Now, this is a very like a strand of the remedy from the entire characteristics that we know, and now we know the remedy more. So, through the other authors, we will definitely explore. Through the Ellen's keynotes, we have explored it immensely, and we found it very useful. So, Dr. Nash concludes by telling us that veratrum viridi needs more proving. It is a remedy that can be given in spasms, twitchings, convulsions. This is what the text writes. And last but not the least, he gives a beautiful case of severe persistent attack of vomiting, which was aggravated on rising from the bed. So, all those cases which seem to be like bryonia, and you are confused about whether to give bryonia, whether to give gelsemium, that is where you should decide to pick up Veratrum viridi. This is what my thoughts are. Next remedy, what Dr. Nash tells, and the last remedy for today is Veratrum album. Now, the beautiful symptom that we all know from the different materia medicas is cold sweat on forehead. It makes no difference whatever is the disease name. It can be cholera, it can be cholera infantum, pneumonia, asthma, typhoid fever, constipation. If there is cold sweat on the forehead, and you can check it by the back of the palm, or tell the relative to check if the patient is not available to see you, because the front of the palm will always give you a false reading. Back is much better. It is more susceptible and more, you can get the clear idea about the temperature. Cold sweat on the forehead, Veratrum album. So Dr. Nash tells us that this remedy is one of the trio of Asiatic cholera. Camphor, cuprum, veratrum are the remedies which Dr. Hahnemann had prescribed for Asiatic cholera. A peculiar mind symptom is there, which is mania to cut or tear the thing, especially clothes with lewdness, lascivious talk, religious or amorous nature, and you find this very close to stramonium. Veratrum as a remedy, you will see in all the cases, whether whatever is the pathology, cold sweat we all know. But the second thing that we know of this remedy is pale, sunken, hypocritic, and weakness, which is peculiar characteristic. And one word definition for Veratrum album that will go hand in hand with everything else what you see in the patient is collapse. There would be coldness, there would be collapse. Mnemonics are already available from lot of homeopaths about C of Veratrum, coldness, cold sweat, collapse, and cholera, etc., etc. So I'm not here to tell about all those things. But what Dr. Nash tells us is that if there are few things that are of prime importance, they are of these things, that is collapse and coldness in parts. And last but not the least, Dr. Nash compares Veratrum album with camphora, and he tells us that in all cases of diarrhea where you see that there are profuse stools and lot of weakness, we tend to give arsenic. This is what my thought is. But if we just introspect the case little bit more, we will find that camphora and veratrum are running very closely. Where should we give camphora? Where should we give veratrum album? Dr. Nash has given us this answer. Veratrum when the stools are profuse, rice watery, and camphora when the stools are scanty in nature or almost or entirely absent at the time when the patient sees. So what happens is that when we go and examine the patient has already passed enormous quantities of stools and he has weakened himself. When we see, we find that there are no stools, passing by the patient. If the episodes are still going on, Veratrum is the remedy. If they have stopped and the patient is nearly in the state of collapse or cold almost there, camphora can be thought. And last but not the least, Dr. Nash tells us that Veratrum album as a remedy is good for rheumatism, especially in wet weather. Surprisingly, a remedy which is left, right, and center prescribed for all the gastrointestinal complaints is also indicated for rheumatism, especially in wet weather, is something which we learned today from Nash Therapeutics. Follow Homeosetu WhatsApp channel, Instagram, Threads, Facebook, YouTube, and Twitter, X, everywhere. Some good learning for all homeopaths is coming soon, so you can stay tuned for this.